Home Health Show, sponsored by Trilogy Home Health Care. We are very pleased to have some very special guests today, Anna Chang and Edwin Charles from Avalina Senior Living. Edwin, why don't you tell us a little bit about where you're located and how long you've been in the area?
Great. So Avalina Senior Living is located in Sunrise, Florida. We're an assisted living community with a memory care. We have 194 beds and 27 are dedicated to the memory care department.
Great. And Anna, why don't you tell our listeners a little bit about yourself and your role at Avalina Senior Living?
Thank you, Stephanie. I am the executive director, and we call it a general manager at our company. And I've been in the industry going on 20 years. January will be 20 years. And I started out as a nurse in an assisted living community. And there I was promoted to the memory care manager. And then I just worked my way up to a director of nursing, a regional nurse, and now an executive director. And I really enjoy working with seniors. I enjoy, bringing them the care that they need. It's been a journey for me, and I just enjoy every moment of it. And this opportunity came about, and I knew that I could make a difference in Sunrise, Florida, in this area. And there's so much opportunity, and I know that will make a major difference here.
Well, congratulations on your new role. You come with many years of experience, and Avalina is the new kid on the block, and we're very excited about it. And please let us know what makes Avalina Senior Living unique.
Well, I believe we're unique in that we have several signature programs where we are resident-centered care. And, a lot of other communities, a lot of other healthcare providers say that they are resident patient-centered care. But when the resident is truly at the center of the care, they're not on our schedule. They're not on our time. We have a 7 to 3 shift, 3 to 11 shift, and then we try to fit our residents into those time frames. And if we're trying to make the community their home, then we have to work around their schedule. And so that's why our programs focus on our residents and what makes them comfortable, what makes them happy, what keeps them engaged. And we have our memory care signature program, which is Valeo, which I'm very proud of. And in Latin, Valeo means to thrive. And, a lot of times residents will come in and you think that they come there to die. And we don't want our residents to come to our community to die. We want them to come and thrive. A lot of times they're home alone and they're declining rapidly because there's no engagement, there's no activity. And when a resident comes to Avalina Senior Living, our goal is for them to thrive, is for them to, do things that their family members or even themselves, they didn't think that they were able to do before. Another one of our signature programs is Create and Compose, which I love. Because that's focused around arts and music, and I'm a huge music lover. And we've seen many times those that are in the industry what music can do for a resident, how they can, they're tapping their feet or they start shaking, and they feel, such positive energy with music and arts. And then we have our legacy kits, our travel times, which the travel times program is where we pick a different country, and our residents, we don't have a community that's open yet for our residents to choose what country they would like to go to. But that country, we're cooking food based in that country. We're doing trivia. We're doing music based out of that country. And it's a very exciting time. And then last but not least, our Creature Comforts program, which is my favorite because I do love animals. And we bring residents, animals in. The residents get to pick a pet that they want. So we have a community pet. For the size of our building, we'll have 2. And so the residents are caring for that pet. The residents are walking and feeding that pet. So it brings them a sense of purpose. So I think that with those 4 that I mentioned, that really sets us apart already. And we can't wait to implement them at Avalina.
Sounds amazing. So much engagement with the residents, and it's really true what music and animals can also bring. especially seniors, but to anybody really. Anna, can you tell us a little bit about what type of staff you will have providing care to your residents?
Absolutely. We have LNS license, which is a limited nursing services. So we will have licensed nurses on staff, CNAs, med techs, and then housekeepers, servers, along those lines. But the staff that are providing care, and what Avalina is committed to doing, is making sure that we're vetting staff. A lot of times staff are just, circling around to different communities, and we want to truly make a difference. And how we do that is by the type of staff that we're hiring, not just in title, but just in character, in skill. We want to make sure that they are experienced in working with the elderly. We do extensive background checks. We call references. We look at the length of time that they were at, their last several jobs. If they're there for, 6 months, and then, another job, they're there for 4 months. We want to see, where there is some dedication and loyalty, that they have that experience with the elderly, that, when, fortunately or unfortunately, we sometimes have residents that have behavioral issues. Are you that type of person who is able to meet the needs of a resident who may be combative? And, if you're the person that gets frustrated easily or annoyed very easily, then, Avalina definitely is not the place for that particular person.
Right. Edwin, can you tell us when would be a good time for a resident to move in to assisted living or memory care? Like, how would you know if somebody should become a resident in your community?
Great question, Stephanie. I think it's depends on the individual. You'll know for the most part when you're ready. We do have an assessment for memory care to see if that's actually a need. When you no longer want to prepare your own meals, and when you don't have the energy to rely on maintenance, it's probably time to maybe start looking into assisted living, or maybe even independent living. But definitely, if when there's issues with memory and maybe forgetfulness, memory care is there, and we can provide those services.
Great. And Edwin, since your community is not quite open yet, and so people are unable to view it in person, anyone that's interested, how can they know about your different apartments? Can you tell us a little bit about that, your availability of your different layouts and everything?
Sure. So right now we're on schedule to open in February. What we're doing in the meantime is we're conducting tours in our sales office where I'm located now. Also, for those that can't commute to the sales office, we're hosting virtual tours. We also offer home visits to come out and sit down and discuss kind of what you're experiencing, and we both get a feel to know if our community is right for you. And yeah.
Okay, great. So what everybody might be wondering now is how do residents and families pay for Avalina Senior Living?
So there's a few different options. Private pay for the most part, but if you were a veteran and you served war at a certain time, there's a possibility that you can apply for the aid and attendance benefit. Also, if you have a pension, that can go towards assisted living. There's also long-term care that you could have paid into. And there's also Medicaid for those that may need some additional services from the government, that they can pay up to about $1,400 for assisted living.
Interesting. And how does Avalina Senior Living work with Trilogy Home Health, our show's sponsor? How do you all work together? Let's let our listening audience know, the benefits of living at Avalina Senior Living, and then also with Trilogy in the mix as well.
Well, with Avalina, we provide many services. And then some of those services that our residents need may be out of our scope practice, our license. We are not a skilled nursing facility. It's more of a resident module. So then we partner with third-party providers such as Trilogy, who are able to provide home health services, physical therapy. If you are diabetic and you need blood sugar checks, insulin injections, we partner with Trilogy in order to provide those services so that you or your loved one can remain in your community, an assisted living community.
Okay. And if you have a resident there whose loved one feels that they may benefit from some of those services that you mentioned, how would they go about finding out more or facilitating that care for their loved one?
Well, we'll have our wellness director, who would be the point of contact for all nursing and wellness services. So we'll have someone that is skilled in that area to assess and see the needs of the residents. But if a family member desires, maybe they used to have those services at home, then they would just notify the director of wellness, and then we would contact the doctor, get a physician's order, and then submit that to Trilogy.
Very good. Very good. Okay. And so Trilogy Home Health Care does offer home health services from Broward County all the way up to the Jacksonville area, and really almost the entire state of Florida. And some of the disciplines that we offer are skilled nursing, as well as physical therapy, occupational therapy, speech therapy, medical social worker, and also respiratory therapy. So there's lots of different ways that we can work together with Avalina Senior Living, and we're really looking forward to that. And we're very excited about your new community. Can you please tell us how folks can contact you for more information?
Before we do that, Stephanie, I wanted to mention that we do have a bridge program, which would, it's a bridge from the hospital, from the rehab to Avalina, but also a bridge with Trilogy as well. If the resident patient at the time in the hospital or rehab is being discharged and their family feels that they still need some more physical therapy, but their days have run out at the rehab, they're able to come to us short stay and still receive those services. So we would be using a third-party provider as Trilogy, and we would be able to provide those services and get that resident to go home safely. Instead of them just being discharged back home from the hospital or rehab and they end up having another fall or fracturing something like that, they would come to us, get strengthened, and then be able to go back home. So once they come in that bridge program, it does not mean that they're going to be a permanent resident with us, but our goal is safety. And so that's the way that we all can work together as well, because we would send the nurse from Trilogy out to assess the residents, who review their records at the hospital or the rehab and determine whether or not this is an appropriate person for the bridge program.
That's a really great service. So it's called the Bridge Program?
Yeah.
Okay, and then so that's basically a temporary stay while they are recovering from maybe a fall or something like that. They can receive additional therapies and nursing if needed, and then they can be discharged back safely to their own home, correct?
Yes.
Okay.
And if their family still wants something more, then they can go home with Trilogy physical therapy, and they can continue the home-based therapy.
Correct. It's definitely a team effort.
Yes.
Okay. So Edwin, can you tell us how to reach you and maybe your website?
Sure. So they can always give us a call at 954-295-4228. And our website is www.avalinaseniorliving.com.
Okay, great. And again, can you tell us again when you are opening?
February, but we are conducting tours now and collecting deposits now.
Wonderful. Okay. Thank you again, Anna and Edwin, for being on our show today. We really appreciate it, and we love partnering with you in caring for your future residents. Have a great afternoon.
Thank you so much for having us.